Second study was looking at how to treat obesity in a large number of patients, especially inner city patients. You often have very little resources. So I started this idea about 2 years ago that I was treating patients in my endocrinology clinic. They would come one-on-one. They'd have to take a couple buses. They'd register. That would blow up basically a whole afternoon for them. And I would tell them, eat more vegetables, eat less fattening foods, and exercise more. I don't think it was that effective. So what we decided to do is get them together in a room, in an auditorium. We have about 20 to 25 people in a room together. It lasts the whole afternoon from about 12:30 to about 3:30, and we start off with some Zumba exercise. We then go to, I give a lecture. I start to talk about how, the detrimental effects of obesity are and the beneficial effects. So sort of stick and carrot approach. If you don't do this, you're going to get all these diseases. If you do this, you'll feel better and your health will get better. I really push long-term effects, no quick diets, lifestyle effects, and really to push it that this is for your overall health, not just to looking at the numbers on the scale. The dietitian gives a lecture, and we have guest lectures. We have somebody talk about exercise. We do this other type of video on exercise called Instant Recess. And the patients ask a lot of questions. They motivate each other. One person says, I lost 10 pounds. Everybody claps. So I think this concept is called a shared group visit or a shared medical group visit. And I think for obesity, it's very effective because the two things for obesity that you have to worry about are one is motivation and two is education. And you can do those in a group setting much better, or at least as good, but probably better than an individual setting. So we looked at some of our data that 15% of the people lost at least 5 pounds, which is reasonably good. Our average weight loss was 3 pounds. Surprisingly, hemoglobin A1C, the marker for diabetes, got remarkably better. It went from an average of 6.8 to 6.0. And we figured out that it would save the county system where we treat our indigent patients $700,000 for doing it versus an individual program. So I think this is a great way to treat patients that are overweight, that there really isn't that much privacy issues. People are already worried about that, but I think this really shows it's a good way to treat patients. It's successful, doesn't require that much resources, and can be ramped up. We do 3 programs a month in English and 1.5 in Spanish. It can be catered to your patients' demographics and their lifestyle time. You could do it in the evening. So I think this is a great way to go to treat obesity. Yeah, I think this is one small step, but I think this can be done, when you think about it, for a large number of people. It could be video conference to another site if people don't want to come in person. So I work in the Los Angeles County Department of Health Services, which treats people that are either have no insurance or low insurance. Most of them are poor, don't have that good access to foods, don't have, maybe the literacy is sort of low. So these are the patients that you really have to target, and you have to target in a way that makes it easier for them, that they're culturally sensitive to them, that they like it, they sort of buy into it, and I think this works for them. I think medicine is moving that way, that you used to have your big medical centers in downtown, and there was trouble with parking and all that, and now people are opening up these satellite clinics. The idea is trying to make it more convenient for the patients, and I think people are doing that with more video conferencing. Also, if there's some energy with being in the room together, certainly, but if you can have another satellite in a different part of Los Angeles, let's say, with another person who sort of coordinates it there, and then I can video my conference to them, and they have somebody who turns it on and sort of gets them to be motivated there also. I think that's the way to go. So I think, Los Angeles is a big city, bad traffic, some not the best public transportation at times. I think you want to try to gear it to where the patients are, whereas ours is, fairly centrally located, but I think we can expand it out to other sites.